Endocarditis. Definition: inflammation of endocardium that line the surface of cardiac wall, usually due to bacterial infection. Causes of endocarditis: Streptococcus viridans is most common overall cause. It is a low-valence organism that infects previously damaged valve, for example chronic rheumatic heart disease and mitral valve prolapse. Result in small vegetation that do not destroy the valve, for example subacute endocarditis. Damaged endocardial surface develop thrombotic vegetation, for example platelet and fibrin. Transient bacteremia lead to trapping of bacteria in vegetation. Prophylactic antibiotic decrease risk of endocarditis. Staphylococcus aureus is most common cause in intravenous drug abuser. High valence organism that infect normal valve, most commonly the tricuspid. Result in large vegetation that destroy the valve, for example acute endocarditis. Staphylococcus epidermidis is associated with endocarditis of prosthetic valve. Streptococcus bovis is associated with endocarditis in patients with underlying collateral carcinoma. Hasic organism mean the mnemonic is Hasic, H for Haemophilus, A for Actinobacillus, C for Cardiobacterium, E for Eikenella, and K for Kingella are associated with endocarditis with negative blood culture. Clinical features of bacterial endocarditis include fever due to bacteremia, murmur due to vegetation in heart valve, gingival lesion, erythematous non-tender lesion in the filament soil, ossular node, tender lesion in the finger or toes, splinter hemorrhage in nail bead, and root spot due to embolization of septic vegetation. Anemia of chronic disease is due to chronic inflammation. Laboratory finding: positive blood culture, anemia of chronic disease. In anemia of chronic disease, HB hemoglobin decrease, MCV mean corpuscular volume decrease, ferritin increase, TIBC total iron binding capacity decrease, serum iron decrease, and percentage saturation also decrease. Here in anemia of chronic disease, all are decreased except ferritin. Transesophageal echocardiogram is used for detecting lesion in valve. Non-bacterial thrombotic endocarditis is due to sterile vegetation that arises in association with hypercoagulable state or underlying adenocarcinoma. Vegetation arises in the mitral valve along the line of closure and result in mitral regurgitation. Liebman-Sachs endocarditis is due to sterile vegetation that arises in association with SLE, systemic lupus erythematosus. Vegetation are present in the surface and undersurface of mitral valve and result mitral regurgitation.